Malaria. What is malaria? Malaria is a parasitic infection caused by parasites of Plasmodium, transmitted to humans through the bite of infected female Anopheles mosquitoes. It's a major public health problem, particularly in tropical and subtropical regions. What is the cause of malaria? Malaria is caused by a parasite of the genus Plasmodium, which is transmitted to humans through the bite of infected female Anopheles mosquitoes. There are 5 species of Plasmodium that can infect humans, with Plasmodium falciparum and Plasmodium vivax posing the greatest threat. What are the first signs of malaria? Patients present with a sudden high-grade fever, more than 101 degrees Fahrenheit. Which is intermittent in nature. Fever can show tertian or quartan pattern. Non-focal. There is no system involvement. Fever subsides with sweating. It is associated with rigors and chills. It can also be associated with splenomegaly. What is the diagnostic test for malaria? Malaria is diagnosed through blood tests that look for the malaria parasite or its antigens. It includes 2 tests. Complete blood count. It shows anemia, low HB, and high eosinophils count. Cause malaria is a parasitic infection. MP test, also known as a malarial parasite test, or peripheral smear for malaria, is a blood test used to detect the presence of malaria parasites in a patient's blood. Is there an error in MP test? Microscopy tests for malaria can miss Plasmodium vivax and Plasmodium ovale infections due to the presence of hypnozoites, which are dormant liver stages that don't appear in blood samples. This can lead to false negative results, especially in the early stages of infection or when parasite densities are low. Additionally, hypnozoites can cause relapses later, even after initial treatment with drugs that only target the blood stage parasites. What are the risk factors of malaria? Warm and humid areas. Malaria is more common in regions with hot and humid climates. Water bodies. Malaria risk is higher in areas near lakes, rivers, or swamps, where mosquitoes breed. Dense vegetation. Thick vegetation provides ideal conditions for mosquitoes, increasing the risk of malaria. Are there any ways to prevent malaria? To prevent malaria, focus on avoiding mosquito bites and considering anti-malarial medication. Use mosquito nets, repellents, and protective clothing, and consider staying in air-conditioned or screened accommodations. Additionally, anti-malarial drugs can be taken before, during, and after travel to areas with malaria.